friends, knee replacement friends. I am 25 days post-op of my right knee replacement. I'm actually in my bedroom. It is 1:30 in the morning, and I literally cannot sleep. This has been a continuous issue. I had a really busy day today. I did a lot of walking because I had to go somewhere and I had to do some walking. But I took a Motrin when I got home. No, I apologize. I took a Motrin before I left. And I took an oxycodone when I got home because I was pretty sore. And I haven't had to take another Motrin for my knee, but I did take an oxycodone tonight around 11, which I normally take one every night. Now it's 1:30. I can't sleep. This has been a continuous issue. I hear this is normal for a lot of people. We just can't sleep. It's just a matter of right now. I got 2 hours of sleep last night. Then I came home and then I took about a 3 hour nap and now I just can't sleep again. I don't really know what it's about, but I'll show you my knee. I actually was laying on my stomach with my leg up on my pillows and was down this way, watching some Survivor. So I was sort of positioned a little bit different. But I'll show you my knee, and it does look really good. I think it looks fantastic, but there is some lines in it right now. Again, just because I was laying on my stomach for about 10-15 minutes. But this is what my knee looks like now. It's looking really, really good. These lines, again, are just from the blankets. I was able to slowly take the glue off. I do wear lidocaine patches on here. I did on both sides this week or today because I was going to be walking a lot. But yeah, this is my knee, and I'm doing really good, and the incision is not long at all. Ben's still having a lot of this knee burning pain, almost like a nerve pain, more on this side of my knee. This is all numb right here, completely numb. I know I'm touching it, but I can't really feel it. Right here is all numb. This side is a little bit numb, but not horrible. As you can see, my bruising is completely gone. My swelling, my foot looks great. I haven't had support hose on in, gosh, 2 weeks now. I am done with physical therapy. I decided not to do any more I'm so sorry. I'm just a little, it's in the middle of the night. I'm not tired, but I can't seem to think or talk. I do go back to school full time next week, so and I forgot what I was talking about. So anyway, yes, so I'm done with physical therapy. If I decide I need a couple more sessions, I certainly will do that, but I think I'm doing pretty well. I'm still swelling quite a bit, so of course the range of motion is going to be different with that. I am probably taking estimately 2 oxycodone. Let me back up with that. The last 3 days, not today, but the last 3 days previous, has been raining, and the barometric pressure has been horrible. Even my good knee was just swollen and horrible. This one also needs to be replaced, but I'm going to wait a bit for that because I just really feel like I need to wait more than a 2-month gap in between. Today was great. The sun's gone, or the sun's out, the rain's gone, the barometric pressure has risen, and because it was so low, and I actually can tell tremendously that I'm not, that the barometric pressure is much better. But there for about 3 days, I couldn't really do a whole lot. So this afternoon, I was walking without a walker or a cane. And yeah, of course, those first few steps is a little, kind of thing, but it's normal. It was like that before I had surgery. So, but I just wanted to give you small updates throughout this journey. I hope you guys are doing great. I hope you guys can sleep because I can't. And yeah, so it helps that I am off of work currently, so I can sleep during the day or nap. But yes, I hope you guys are all having a great journey, or if you're getting ready to do this journey. I had a great surgeon. I know I've said it before. I had Dr. James Lyons in Maumee, Ohio. It is very close to Toledo, Ohio. I know that everyone has different recovery speeds and just recovery, healing times. I will, and I know I've spoke with this about my previous videos. Something that I do is I do lymphatic massages or massages on my leg. I've been doing them probably 2 weeks post-op. I started doing them. I just put my leg in the bath, sit on my shower bench, and I literally just soap my leg up with, I use Johnson's Baby soap. Sensitive is what I chose to use. And I would literally just, I'll show you, I literally would just rub and get all of the fluid up here. Just push all the fluid up there. Rub and rub and rub and rub and in the foot. And because of that, if you look at my previous pictures, you will notice that all of my bruising went away pretty fast. I am anemic. I'm always anemic. I'm very mildly anemic right now. It's very mildly. So I bruise really easy. It's just the way I am. So, but that does help as well. It's not something I was really told to do, but one of the physical therapists mentioned taking a rolling pin and rolling out your leg. I don't have a rolling pin, so I decided to do it like that, like lymphatic massages for, in my case, breast cancer patients. Um, that's just in my field of what I work with. So I decided to do that with my leg, and it was definitely a good, just gets the the fluid out of the leg, gets things moving, gets you healing faster, all of those things. I have been putting Neosporin on my incision about once a day. That's it, not a whole lot. That's it. But I hope you guys are doing good. If you are if you are thinking of doing this journey of this knee replacement, I'm asked a lot, do I regret it? No, I know I've said that all along. No, I do not regret it. It's now, I'm 3.5 weeks. Some days are better than others. Some days are not good. Today was a pretty good day considering how much walking I did. And of course, yeah, it's 1:30 in the morning and I'm still awake and I don't think I'm going to be asleep anytime soon. And I took an oxycodone like 2 hours ago and I'm still wide awake. But this surgery is not easy. You just please know you're going to need time to recover and not overdo it. I overdo it. Unfortunately, I just end up overdoing it. That's just me. I'm younger, not younger meaning as a normal knee replacement recipient or patient. I'm 51. This was not a plan. Anytime this year, I end up in December tearing my meniscus right off of the tibia. I literally did nothing. I stopped drawing and it went, and been in extreme pain ever since. Then by the time I got an MRI and saw my surgeon, he's like, listen, there's nothing we can repair. Your meniscus is like torn in like 3 spots. This just didn't happen overnight. This is something I had been tearing. I do work in the medical field. I'm on my feet all the time. Love my job, but I'm on my feet all the time. And so my left one is going to have to be redone eventually. I'm currently in school as well, and because of that, I'm gonna have to do some some externships. Because of that, that's gonna put me back in the hospital as a employee or as a student, back on my feet for many hours. So I really don't think, unfortunately, I'm going to be able to do my left one until after I'm done with school, and that's okay. It's okay. It's okay. Alrighty. Well, I hope you guys are sleeping much better than I am, because I'm not sleeping at all. Like I said, I am literally, this is my headboard. I am just laying in bed, watching Survivor. That's one of my binge watches lately. All right. Have a great day. Hope you guys are all sleeping well. Blessings to all of you. And yes, If this is for you, get it done. The pain is still there. It's just in a different spot. It's just a different pain. And this pain will go away. But I'm doing really well. All right. Much love. Bye-bye.